Hey everyone, good afternoon. This is County Executive Pat Ryan. Appreciate you joining us today. I'm going to give our COVID update, talk briefly about what's going on with vaccines, which we talked quite a lot about on Tuesday, and then also give an update on our Project Resilience efforts, one of the real beacons of light and hope in a very dark and challenging time. So we have some more work that we're doing there thanks to the generosity and the work of our community. So we'll talk about that as well. The overall COVID situation, I'd say, is essentially the same as we were 2 days ago. We're on most metrics holding about steady. Diving into the specific data points, total cases in the county cumulatively are now at 9,263. We've tested just shy of 240,000 tests, which now means we've done far more tests than we have residents. We have had the vast majority of folks recover, 6,576, and unfortunately we continue to see the fatality numbers climbing and climbing. Just in the last 48 hours, 4 additional Ulster County fatalities from COVID, bringing us to 209. And as we approach the end of this month of January, it has just been an absolutely devastating month, by far the worst of the pandemic in terms of loss of life. And I hope we can all both mourn and send condolences to those that have lost loved ones and to those we've lost, but also use that as a impetus to continue to keep our head in the game and change our behavior and take this as seriously as it should be. Hospitalizations are pretty much steady, actually slightly down from 2 days ago. We have 32 Ulster County hospital beds occupied with COVID-19 patients. 3 of those 32 are ICU beds. That is down from 35, but our rolling average is right there, still above 30, has been consistently above 30 for a few weeks. And I hope that starts to tick down, as we have started to see the total infection rate begin to tick down, hopefully for good. Active case count, we are watching this carefully, continues to be much higher than we would like at 2,478 active cases. Again, our hope is that this represents an apex of the second wave here, but we said that a few weeks ago, and unfortunately it didn't hold true. I think the difference now is that we are approaching, or even possibly at, the point where the holiday impacts from Hanukkah, Christmas, New Year's, and other winter holidays, we think we've seen a good amount of those impacts now, and so the optimistic view of that would be that we will hopefully start to see the active cases tick down. That only, of course, happens if everyone collectively continues to follow precautions and make those right decisions for the greater good. In terms of the positivity rate, the new positivity rate, this is definitely the most encouraging data point I get to share today. The new positive rate over the last 48 hours is the lowest it's been in several weeks. It's at 5.35%. So in the last 48 hours, we tested 3,344, 3344, and of those, 179 were positive. So again, in the last 48 hours, 5.35%. That is very encouraging. If we can bring that new positive number down and down and down, that will, over time, of course, bring the active case number down, bring hospitalizations down. It all starts with controlling the speed and sort of volume of spread. And so I am glad to see that indicator ticking down and hopefully continue to tick down. That all informs our looking out cumulative projections, which you can see on this slide. You can see that steady climb of cumulative cases going back to the end of November. It's kind of remarkable. We were at less than 3,000 total cases, and in those few months we're now well over 9,000. So it really has been the most challenging period of the pandemic, even though it feels different mentally, and it feels different in terms of the stress and also, for some, frankly, the compliance with the guidelines and the restrictions. So let's continue to try to get that curve flattened back down here as we get through the winter. Hospital capacity looking forward, we're in very good shape here. You can see the current numbers at 32 once again, and more than sufficient need for the near, medium, and long term at this point. So that is encouraging. As always, the way we affect this, particularly in light of a continued limited supply of vaccines, the way we affect this is at the individual level, the family level, the workplace level if you have to be at work, and following the precautions of mask wearing, hand washing, social distancing, and in particular in the cold period we're in right now, avoiding those indoor gatherings with really any number of people for any extended period of time. That is the highest risk way to transmit or to get COVID based on all the science we now know. So that's where we're at in terms of the current state of the pandemic. I hope that we continue to get those numbers down. We cannot sustain the levels of new cases, of active cases, and of course of deaths and really sick people that we've got. Quick vaccine updates. The high-level takeaway remains the same, which is that we still very much need more vaccines here in Ulster County. We need them urgently. This week we received, if you remember from Tuesday, we received 1,500 total across the county for this week's allotment from New York State. Those are being administered now, 700 for seniors, 400 for healthcare workers, and 400 for first responders, teachers, and others in Category 1B. Tomorrow, our Kingston High School point-of dispensing pod site will be open tomorrow on Friday, primarily doing those 1B folks. The pharmacy partners are out there doing the 65 and up, and our healthcare partners at Health Alliance are doing the 400 healthcare workers. So on the ground here, everyone doing their part. As we get these doses, we are immediately turning them around, getting them out to people in need, and you can be sure that no dose will be not used, and we've even been able to, as many of you have probably heard, in some cases extract an extra dose out of some of the vials, which is authorized and permitted. So that's allowed us to do sometimes even to get even a few more people vaccinated than the allotment. So we're continuing to push, of course, safely on that front. In terms of looking forward next week, we won't know our exact allotment probably until some point over the weekend or early next week. However, based on very encouraging action from the federal government and from President Biden, we can now pretty reliably expect in New York State a 16 to 17% increase over what we currently had over the last few weeks in vaccine allocations. And also, equally as important, we can that number, whatever it is, will be pretty much guaranteed 3 weeks out, finally giving us the ability to have some longer-term view and predictability and start to book things out further. Because right now, we're sort of week to week or even day to day based on the lack of really clarity from the federal government. So we expect that will continue to improve both in terms of clarity and predictability and also volume. At the current rate that these vaccines are essentially trickling in to us and to others doing the doses, we would be well over a year to get everyone vaccinated at the current rate, which is absolutely unacceptable. And I know that at the national level, the Biden administration and the whole team working the COVID response is doing everything they can to address that. We also know more pharmaceutical companies are likely to come online, Johnson & Johnson and others in the coming weeks. So that will all hopefully come together and reflect here on the ground in more doses. And we have been and remain ready to do up to 1,500 a day 1,500 a day, sorry, too many numbers, here in Ulster County. That would let us do 45,000 a month and very quickly get through, along with our other partners doing this, get through our entire county population. For those that are, like everyone, anxious and uncertain, I know that there are a lot of questions. We're getting still many questions, emails, calls, and questions. The simplest single place that we set up to try to answer your questions, and I think we've really been able to get most of them up there on our Vaccination Resource Center. That's a single web page where you can go to vaccinateulster.com. That has all of the Ulster County specific information about eligibility, frequently asked questions, and a sign up to get more information. Right now, if you're signing up for that and you're not getting a lot more specifics about an appointment, that's because we don't have enough doses to open that up as widely as we can. But by signing up on that list and clicking that vaccine notification request, that puts you on that list so that when we have appointments available and you're eligible, you will get that direct link and you'll be able to sign up and book your appointment. So please, if you haven't signed up there, do that. If you have, you'll continue to get updates as we have them, in addition to these updates that I do twice a week. For those that have trouble accessing the internet for whatever reasons, we've got our Recovery Service Center line available. That's 443-8888, and our Office for the Aging is available for seniors that need help navigating this. So we will continue to share that as well out there. And please, if you've gotten yourself taken care of, that's great. Think about 2 or 3 or 4 or 5 others in your life or in your neighborhood who you can safely reach out to and get them signed up and taken care of. This is a time, as we've been doing this last year, where we all have to do our best to take care of ourselves, but also those among us who might need a little extra help. On that note, that's a segue to talk about our Project Resilience efforts, which I continue to be so proud of, and really gives me continued hope and optimism as we now get almost a month into 2021, that we'll continue to tap this really sea of goodwill and selflessness and generosity and compassion that Ulster County has stepped up with from day one. So heading into the winter, we knew that the need would continue to grow, and it has. And so we relaunched a new phase of Project Resilience in Ulster County. That was back prior to the holidays. We launched that. And this phase is focused really on 3 primary areas. It's focused on our seniors. It's focused on our youth, the young people that have been under so much pressure and challenge, and of course their parents and family. And then all of our families who are living paycheck to paycheck or may not even have any income right now, given the economic impacts of COVID. We've launched and are continuing to roll out a series of programs and initiatives to help all those folks. So I wanted to share a few more of those with you today. In terms of food security and meeting the huge need for food, of course, this has been the thing we've been doing primarily from day one with Project Resilience. And we wanted to, heading into the winter and now deep into the winter, make sure that our entire really food bank and food pantry network throughout the county, which is extensive, that they all had the resources that they needed. So our team reached out to every single food bank in the county, asked them how they were doing, what they needed, what their shortfalls were. And then we had 16 different food pantries from within Ulster County come back and say, yes, we could use some help. We've got more people lined up than ever before, and we often have less resources. So through Project Resilience, we're granting $80,000 total to 16 different food banks across Ulster County to really help meet that surging need. I was down the other week with one of the great food banks down in Plattekill, meeting with the folks there, as well as the Walkill School District, all working together not only to get meals out of their food pantry there, but also to deliver backpacks with food and supplies to our kids through school, and actually using pretty creatively using the school's bus system to, rather than bringing kids to school, to deliver food to homes using the bus system. So the creativity and ingenuity of all of our leaders here has been fantastic to step up and meet this need, and we want to do our part there. Through that additional support, we can provide approximately 120,000 additional meals for residents throughout the county. That brings our collective Project Resilience work and impact to nearly 500,000 meals that we've delivered to Ulster County residents throughout this pandemic. And I continue to just be in awe of how well that's going, and the stories and the anecdotes and the messages we get from those that are getting help really are bright moments in a tough time that we're in. The other thing that we're focused on, as I said, in Project Resilience is supporting our young people who have been in and out of school in person, have had to figure out how to work virtually, which is, as a parent, and talking to parents with older kids is almost impossible, to be honest, and we know how difficult this has been. We're trying to do everything we can for those that have to work and need childcare to support those efforts. So in partnership with the Center for Creative Education and the Boys and Girls Club of Kingston and Saugerties, and also the YMCA of Ulster County, Project Resilience is supporting scholarships for 218 young people throughout the winter at those institutions, so that those kids have a place to go throughout the day and into the afternoons and evenings and even the nights, as all of our frontline workers are having to do this critical work to make sure that their kids are taken care of, that they can learn, that they can be safe and healthy and have some degree of support, both educational and emotional and everything else. So that has been excellent. And then today also we're announcing a new piece to that, partnering with the YMCA to sponsor a new program in Ellenville, where the need has been very great and where there hasn't been a program like this. We're starting a new drop-in childcare program for kids grades K through 6 in Ellenville. And since this is a new program, I wanted to make sure we put up the number for those living in Ellenville, in the Ellenville School District. If you want to get involved in that and you need some help taking care of your kids at this moment, you can call that number 338-3810 and the extension 122, and that'll help plug you into that in partnership with the Ellenville School District and the Y. So we want to thank them. Again, I could go on and on with the different individuals and organizations that have stepped up when they were under great pressure and need to help those in greater need than them. And I really think that we've led the way in Ulster County, and a lot of that is thanks to the generosity of folks who've contributed to Project Resilience. So if you are in a position where you're able to help with Project Resilience, getting food to those in need, helping our young people and their parents, and helping those living paycheck to paycheck, if you're able, you can contribute on the GoFundMe page, which is set up in partnership with our leading partner here, the United Way of Ulster County, Stacy Ryan and team. Thank you. You can go to this page. It's through our COVID-19 portal, or you can just look up the Project Resilience GoFundMe page. Even a dollar or two, if you're able, will help provide a meal or an hour or even 15 minutes of childcare, which I'd take 15 minutes of childcare right now. My wife and I could tell you that much. So please do, if you're able, support. On that note, I want to thank everybody that make up our core of frontline and essential workers. The list is here, and there's way more than this that have continued to be heroic and put themselves at risk to get us through this. So thank you to each of you. Thanks to everybody for tuning in and staying engaged and doing everything you can to stay positive and optimistic and be patient. I know this is difficult, especially with the shortage and limited supply of vaccines. I know it's very hard, and it's heartbreaking to not have enough supply to get it to all of you, but we're doing everything we can to fix that from the top, and when we get them, believe me, we will be ready to get them out as quickly as we can receive them. In the meantime, our next update will be on Tuesday at 3 p.m. If you have any needs, you can call our Recovery Service Center. That number is 845-443-8888. I do want to give a final special shout out to our team that's staffing our Recovery Service Center. We built this thing on the fly right after COVID hit, and it's staffed by volunteers. And right now they're taking hundreds of calls a day, many of them from people that are, understandably frustrated and worried about getting the vaccine. And they are doing such important work to just be there, to be a caring human who's able to answer as many questions as we can, to get you what we can get you, and at least at a minimum to just be able to be there for each other in a really tough moment. So thanks to our team staffing the RSC for your work. I know it can sometimes be tough. On that note, lots of thanks today. Sorry about that, but I really am appreciative of so many doing so much. So we'll see you in a few days. Stay safe and healthy, and let's stay resilient together through this.